Thank you for joining the Dougherty County Board of Commissioners Commission meeting. Your Dougherty County Board of Commissioners is chaired by Christopher Cohelis. Your Dougherty County Commissioners include, from District 1, Lamar Hudgens; from District 2, Victor Edwards; from District 3, Clinton Johnson; from District 4, Russell Gray; from District 5, Gloria Gaines; and from District 6, Anthony Jones. We are also joined by County Administrator Michael McCoy, Assistant County Administrator Scott Addison, County Clerk Juwan Ware, and County Attorney Spencer Lee. This is your Dougherty County Board of Commissioners Commission meeting.
And we'll begin with the prayer and then the pledge. If everyone would please first bow their heads. Dear Heavenly Father, thank you for this time that we have to come together to do work for the citizens of Dougherty County. Thank you for the many resources that you have provided us with, and thank you for our growing health in the wake of very uncertain times. Thank you for our healthcare professionals and our first responders and the many other people that have provided so much hard work and dedication to this community during these uncertain times. We thank you for the many blessings you have given us and that you continue to give us. In Christ's name we pray. Amen. Everyone will please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. First item of business, consider for action the approval of the June 29th special call and July 6th regular meeting minutes. Is there a motion?
Motion to approve. Second.
Motion and a second. Thank you, Commissioner Jones and Commissioner Edwards. Any comments, questions, or discussion? Okay, we'll call the matter for a vote. Those in favor signify by saying aye. Aye.
Aye.
Any opposed? Motion carries unanimously. Delegations, this is where the commission will hear comments on those items pertaining to Dougherty County for which a public hearing has not been held or scheduled. We ask everyone to be brief to the point and considerate of time for others. At this time, do we have any delegations? Mr. McCoy, we have no delegations, is that correct? And we had no one that previously signed up. All right, we're going to move on to the next item, consider for action the resolutions providing for the execution of related documents pertaining to the adoption of the Community Home Investment Program CHIP grant for the Dougherty County Board of Commissioners. Mr. McCoy.
Yes, sir. Thank you, Mr. Chairman, and good morning. This is a requirement in order for us to get our CHIP program off the ground. We were awarded this CHIP grant back in April, I believe, and it's going to take 6 to 8 months to get it stood up, as we have to meet 16 general conditions. And these are part of some of those conditions. So there are multiple resolutions that need to be adopted in order for us to get our program operational.
All right.
So we recommend approval.
Very good. Is there a motion?
Motion to approve. Second.
Motion and a second. Any discussion? There being none, we'll call them out for a vote. Those in favor signify by saying aye. Aye?
Aye. Aye.
All right, any opposed? There being none, motion carries unanimously. We'll move on to the next item of business. Consider for action the resolution providing for the acceptance and execution of the proposal from Augusta University Health to provide clinical antibody testing and to provide insight into the community spread of COVID-19. The Coronavirus Task Force Subcommittee recommends approval of the proposal for an estimated cost of $162,000 that will be cost shared equally between the City of Albany, the Dougherty County School System, and Dougherty County. The county's estimated expenditure is $54,000. And it says $144,000 plus $18,000 travel, lodging, and meals, which is the total cost. Funding will be provided from the general fund. Mr. McCoy and Chief Scott and Augusta University Health VP Innovation Officer Mallory Myers are present to address. And good morning, Ms. Myers. Good morning, Chief, and good morning, Mr. McCoy. Thank y'all. Let me begin just by saying thank y'all for your hard work on this project. I'm going to turn things over to Mr. McCoy at this time.
All right, thank you, Chairman. Appreciate you and your leadership. This resulted from a lot of work and discussion that started with the Coronavirus Task Force, which is led by the chairman as well as the mayor. And as far as the subcommittee is concerned, that was made up of myself, Chief Scott, Ms. Subadan, and Scott Steiner served as our advisor. And we have been working diligently with Augusta University. As you all know, they've done coronavirus testing in our community. We were very hard hit by the coronavirus early on, and we are recommending participating in this study, investing in this study, to help us get more insight in the long term as to what we experienced in our community for researchers for years to come. We think that this is a valuable investment that will give us a return on our investment for many, many years to come. And we have, again, Chief Scott on the line, as well as Ms. Myers, to answer any detailed questions. You all have the proposal, and if you have any questions relative to the proposal, we're prepared to answer any of those at this time. Thank you.
Very good. Thank you, Mr. McCoy. And I'm just going to toss out a couple of questions for informational purposes. This is for antibody testing, which is different from testing for the actual virus. This is actually to give us an idea of how many people have recovered from the virus and which potentially have some form level of immunity to the virus. And I recognize that's not an exact science, but it is an important piece of information that we have. And I also recognize that we have Dr. Kuhl from Augusta University also on the line. Dr. Kuhl, could you please provide us with an overview of what this testing will provide in terms of value for our citizens and our community, please?
Sure. So thank you, Mr. Chairman, and appreciate the opportunity to speak. I'm the Vice President and Chief Medical Officer for the Augusta University Health System. And this testing is basically would tell us what the impact on the community was. As you know, especially very early on in the COVID-19 disease outbreak, that testing was very limited, and therefore a large number of people went untested, and others may have experienced very mild symptoms and were not diagnosed, and therefore are not included in the total case numbers for COVID-19, which makes understanding this disease more difficult. Given that the Dougherty County area was particularly hard impacted, we feel like it's important to understand what the true prevalence of this disease was on the community, and then also understand what impact that may have moving forward in terms of decision making. Some smaller similar studies have suggested that the infection rate was much higher than that which was officially documented. And we feel like that because the Dougherty County area was particularly hard hit, that it's important to really understand what has happened and then also allow that to inform future decision making, particularly as it pertains to risk moving forward. The test that we are using at Augusta University is a highly specific, very highly sensitive test. And as you mentioned, what immunity means is still not fully understood, but we are using a very specific test. And more importantly, one of the things it's important as to why that test needs to be performed at Augusta University is that our study methodology will tie the the results of the patient to a survey of the patient, but without anybody except one person being able to link those two together. And secondly, the other piece of that is that although there is FDA approval for this test, the FDA approval does not include the inclusion of what we would call a titer level as part of that result, but we can report that in terms of a research study. So say, for example, if we know that people had symptoms, but they were further out from the illness than others, their titers or the level of the antibodies in their blood is not something that we could report out or that other labs could report out as part of their results, but we are able to study and report that out as a group, which would really help to inform what might have happened in the community, particularly for those that might have had symptoms early on in the illness. That's a brief overview. I'll be glad to entertain any questions that you may have.
Very good. Thank you so much, Dr. Kuhl. At this time, I'd like to call for a motion.
Motion to approve.
Second.
All right, motion and a second. Any discussion?
Question, please. This is Gloria.
Yes. Commissioner Gaines?
Good morning. Good morning. Just a couple of questions for clarification. Are similar studies being done for other counties in Georgia or perhaps other counties in other parts of the country? That's one question, and I do have others.
Yes, ma'am. Dr. Kuhl, can you speak to that, please?
Sure. There are studies that have been done in other areas of the country which show a what we call a seropositivity rate of 10 to 20%, and in some cases higher. However, some of those studies have been done with less sensitive, less specific tests, and so interpreting those results gets a little bit uncertain. We have done other studies in Georgia. We currently have a study where we have a study that has concluded, but has not been fully published yet in Columbia County, Georgia, which has not been hard hit by COVID and has actually been fairly well spared. And we think that because Dougherty County has been so heavily impacted by this disease, that this will be a very useful study for informing the science, not only for Georgia, but also for the rest of the country, especially given contrast with other locations.
The second question, please, is about the cost. We are indeed one of Georgia's poorest counties, and as you can imagine, we just adopted a budget that is really quite tight. And I'm curious, since it is such an important study, not only for Dougherty County, but for the disease, to inform all who are concerned about how the disease manifests. Was there any attempt, and this may be for Mr. McCoy and members of the task force, was there any attempt to find funding for this study other than hitting our general fund?
The answer is yes, Commissioner Gaines. We did, and I want to go back and recognize Mr. Dyer. He was also a part of that subcommittee. We are sharing this cost between three organizations. Everyone was in favor unanimously of moving forward with this, and so we did have funding available because we recommended an increase in our contingency fund for COVID-19 costs. And so we're well covered in that regard. And secondarily, we are going to proceed with requesting reimbursement, either through the CARES allocation that we have available from the state in the amount of $800 and almost $50,000, and we may even pursue reimbursement from FEMA. But we are looking at all of the possibilities to minimize the economic impact of this study, but we do believe that it has tremendous value, and again, we recommend approval.
So you do believe that there is the chance that it will be reimbursed?
We're going to pursue...
For the record, Mr. McCoy.
Yes, ma'am. We believe we are going to pursue reimbursement for this expense. If we don't get reimbursement, we allocated an additional $100,000 for unexpected COVID expenses.
Very good. Very good questions. Very good answers. Thank you,
Mr. Chairman. I have a question.
Yes, Commissioner Johnson.
Hey, how many tests will be provided for this cost? With three entities, yes, sir, being involved.
Yes, sir. Yes, sir. Great question. So yes, this will not be mass testing. They recommended no less than 1,000, but at least up to 1,800. And our budget figure is based on 1,800 tests.
1,800 tests. Now, is this by age groups? Is this by demographic? What's the methodology?
Great question. Great question, Commissioner Johnson, and so one of the things that we expressed, both the mayor, myself, and staff to the subcommittee, was that we wanted to make sure that it was a completely representative sample of the community from a demographics perspective, age perspective, and geography perspective, and so Mr. McCoy, can you speak to that, or Dr. Cool? I know y'all have come up with a methodology to make sure of that.
Yes, Ms. Mallory, I believe, will speak to that.
Okay, Ms. Mallory, Ms. Myers, or Dr. Cool.
About the demographic breakdown?
Yes.
For the testing group.
This is Dr. Cool. I can take that.
Sure.
Okay.
Yeah. So what we would typically do is we will create schedules around the testing that looks for representative groups or have some other targeted efforts. The exact details of that we do not have worked out yet, but we do want a representation across different groups. And we will have to get that study methodology or how people get put into those groups defined and approved by the research board. But we will work to make sure that this is representative across those different groups within the community.
I do have one other question, please.
Sure. Commissioner Johnson, did that answer your question?
Yes, sir, it did. Thank you very much, Mr. Chairman.
Very well. Commissioner Gaines.
Yes, thank you. When will you initiate the study, and how long will it take?
The initiation will likely be in the next month or so. We'll have to work out the logistics once it's formally approved, and that will be also dependent on the research board's approval of the study. So that sometimes takes a week or two to go through all of those different approvals. In other studies that we've done of similar volumes, usually 1 to 2 weeks, but it is really dependent on how quickly we get individuals from the community scheduled. So if we're targeting a sample size of 1,800 and we only have 1,000 individuals signed up, we'll have to work with y'all to determine what the cutoff point is, because we will have to have staff available to support the effort. So typically 1 to 2 weeks. For 1,800, I would suggest 2 weeks.
Okay. Very good. Commissioner Gaines, did that answer your question?
It does. Thank you.
All right. Very well.
I have a question, Commissioner. I have a question, Mr.
Yes.
Chairman.
Yes, sir. Go ahead, Commissioner Jones.
I want to know how payment is going to be made on this. Since you all don't have the bugs out of it yet, will the check be cut before or prior to? Will you all have a true plan in place before the funds are given out here? Because I'd like to see that. I'd like to know exactly what you're going to be doing, how you're going to be doing it, how long you're going to be doing these questions that are being asked. I would like them to be answered before any payment is made, so that we'll all be on the same page and know what's going on.
Yes, sir. I understood, Commissioner. Fair point. We met last week, the subcommittee, and it was recommended that we move forward. So I'm the first organization to bring this to my board, and of course, the city will be presented this on tomorrow for approval as well. And yes, we are still in the developmental stage with some aspects of this particular project, and we will come back and provide you specific information relative to this program and how it's going to be implemented at a later date.
Very good. Very good question.
Prior to the check being dispersed, right?
Yes, sir.
Yes, sir.
Okay.
Very good.
Thank you.
Yeah.
All right.
Yeah.
Thank you, Commissioner Jones. Yes,
Chairman.
Commissioner Gray?
Just had a general question, kind of two parts. One, who will own the data? Is it Augusta University, or will the three entities in Dougherty County have co-ownership of the data? And two, how will the results of this really be used to help us in a future state, other than seeing, how widespread exposure probably was compared to what we know through testing that was done?
So I think, Commissioner Gray, you raised a really good point. One of the purposes that I had in the back of my mind, and I'm going to ask Dr. Kuhl to comment on it, is it has, from my perspective, a significant economic impact for our community, because I've watched as our community has essentially been labeled as a black sheep across the state, because we initially were the epicenter for the coronavirus outbreak in the state of Georgia. In reality, we withstood a tremendous onslaught of the virus and frankly handled it very, very, very well given all of the circumstances. In actuality also, we're probably closer to attaining herd immunity than many of these other jurisdictions are. And in terms of how we move forward I've talked with folks that literally have said, yo, you're from Dougherty County, don't even come near me. But it's really based on sort of, frankly, an ignorant view of how the disease process works. We're probably well far ahead of many other communities in actually establishing herd immunity. And I like, and this is from my own perspective, this actually gives us some data points on a moving forward basis so that we can say, look, this is where we're at, and Dougherty County is a much safer place than these other places are potentially. So that's one component of that. And Dr. Kuhl, can you speak to that as well?
I think you stated it very well, and I agree with your comments 100%. In addition to the question about the ownership of the data, we would co-own the data per se, in that we would, of course, we would technically own it because it is protected health information and research data. But what we will do is provide back to Dougherty County de-identified data from the individuals that will allow you to see what the data shows in a way that does not breach privacy laws. And we would not release any data without, for example, to the media or anything like that without the prior approval and in conjunction with Dougherty County.
Very good.
So, and another question that came up in that regards, the liability of Dougherty County owning that data and having people show positive for the antibodies. Certainly that means they've been exposed to the novel coronavirus and developed antibodies. Would we be liable in any way if that individual was not reported through state measures to Department of Public Health, as in any healthcare professional would be legally required to?
The antibody testing isn't a required reportable result at this point.
Okay.
All right.
And also, this is Dr. Kuhl. If the question was, does that mean that we missed reporting someone earlier who might have been positive? We know that there are lots of people who were positive that never got tested, never got reported. And then the comment about if you find out that someone is quote unquote positive on an antibody test, so the data that would come back to Dougherty County would be de-identified, and you would not have visibility of who actually tested positive or negative in the data that you come back. It would be de-identified conglomerate data based on groups of people or zip codes or things like that, but not where you could tell that Bob Smith that works in the Board of Education was positive.
Thank you.
One other question to Dr. Cole. Dr. Cole, is it?
Yes.
I heard the chairman mention the concept of herd immunity. I was under the impression that herd immunity would only occur if you were somewhere north of 60%, 90%, or what is that percent of infection before?
Yeah. The generally. Yeah, and it actually, the level of herd immunity required is a bit of an unknown. Most people believe that it's about 60% is necessary to achieve herd immunity, but that changes based on what's called R0, or the infectivity of the virus is. In other words, the number of people that are actually infected by an individual who is positive. So, it's a little bit of a moving target, but generally accepted at 60% for this virus right now as best evidence.
Okay, thanks.
Right.
However, it's important to know that the more people that have antibodies, the slower the disease will move through the community. A herd immunity of, say, 60%, if 60% of the people have the virus, that's essentially where the virus starts to die off almost completely. So any figure that is somewhere south of that, the more people that have had it and had antibodies, the slower the disease will move in terms of transmission.
Mm-hmm. Well, I'm just curious what we will learn that is different than, say, New York, which has done quite a bit of study of antibodies, the presence of antibodies in folks. But you don't have to answer that, but I'm just curious about it. Because there are other places that have been doing it, and certainly New York is one of those places that has done quite a bit of antibody testing.
All right. Very good. Very good points. Thank you, Commissioner Gaines. At this time, I'm going to go ahead and call the matter for a vote. Those in favor signify by saying aye. Aye?
Aye.
All right. Any opposed? All right. Motion carries unanimously. Thank you very much. Hey, Dr. Cool and Ms. Myers, Chief Scott, thank you very much for your work on this. We appreciate your partnership and all the hard work that y'all are performing for the citizens of Georgia. Thank you so much.
Thank you for having us.
Thank you.
All right, we're going to move on. Consider for action the approval of the alcohol application from SNR 2020 LLC, Saeed Fuel licensee, DBA Pace Car Express, at 3500 Sylvester Road for beer package. The Albany Daugherty Marshal's Office recommends approval. Madam Clerk?
Yes, good morning, Chairman. We recommend approval.
Okay. All right, is there a motion?
Motion to approve.
All right. Motion and a second from Commissioner Gray and from Commissioner Gaines. Any discussion? There being none, we'll call the matter for a vote. Those in favor signify by saying aye. Aye?
Aye.
Any opposed? Motion carries unanimously. Consider for action the resolution declaring 3 interior protective car shields cages and 1 emergency light bar as surplus and authorize the transfer at no cost of the same to the Daugherty County School System Police Department. This request is made on behalf of Chief Troy Conley to assist in the safe transportation of children due to the COVID-19 pandemic. Mr. Addison and Madam Clerk. Mr. Addison.
Thank you, Mr. Chairman. We recommend approval of this surplus and transfer to assist the Daugherty County School System.
Okay, is there a motion?
Motion to approve.
Second.
Motion and a second. Any discussion? There being none, we'll call the matter for a vote. Those in favor signify by saying aye. Aye?
Aye.
All right, any opposed? There being none, the motion is declared approved unanimously. Mr. McCoy.
Nothing further, Chairman. Thank you.
Mr. Lee?
Nothing, Mr. Chairman. Nothing, Mr. Chairman.
All right, thank you. Commissioner Gaines?
Yes, thank you. I'd like to take a moment to pay tribute to Congressman John Robert Lewis of Atlanta's 5th Congressional District for his 17 terms of service to the people of the United States. I pay tribute to him for his absolute commitment to nonviolent social change and his deep and abiding love for humanity. I'd also like to thank him for getting me started in life. He hired me as my first real job out of college, and I had the privilege of working with him for almost 3 years and learning quite a lot from him. So I do take this opportunity to recognize his body of work over his lifetime. Thank you.
All right, thank you very much, Commissioner Gaines. Commissioner Jones?
Yes, Mr. Chairman, I will be serving as the voting delegate with the NACO, National Association of County Commissioners. I will be serving as voting delegate for our group here in Dougherty County again this year. That conference call will be taking place today at 2 o'clock with the business meeting. And also, I have been fortunate enough to be able next year to serve on the membership committee for the National Association of County Commissioners. I thought it was fitting. Ms. Kim Hall, who is the membership director, there is an application process that goes along with this, and then an acceptance. But when I called in to talk about my request and interest in wanting to be, she said since I was coming from the state of Georgia that I would be able to forego the application. So I thought that was real special for me to not to have to fill out an application because I was from Georgia. So next year I'll be serving in that role.
Very good, and thank you for your service, Commissioner Jones. We appreciate your service locally and abroad for us, and that's a big honor. Thank you very much.
Thank you, sir.
Commissioner Johnson.
Good morning, sir. I have nothing further other than I mirror the comments of Commissioner Gaines and the loss of our great leader in John Lewis. That's it. Thank you.
Very well. Thank you. Commissioner Edwards?
Yes, sir. Two things, Mr. Chairman.
Yes, sir.
I guess I would like to ask the county administrator, in reference to the county police, how many officers do we have per zone per shift?
I'll have to follow up with you.
Yes, sir. Yeah. It was that, I don't know if you guys was aware of, I guess about 2 Sundays ago, that convenience store on Holly Drive was broke into again. You know, the first one we had early this year was robbed, but the second time, and I guess the store owner, his complaint was concerned.
At Radium and Holly?
Yeah, the corner Radium.
Right there on the left when you're coming down Radium.
Right.
Okay.
And he has this big garage door.
Uh-huh.
He closes it. You know, he closes. He's the only store I know in the county closes at 7:30. And between 3 in the morning and 6, someone actually broke the door, raised it up, then went through the window. But the central monitoring thing in our county police, it was actually a 45-minute process.
Wow.
So that's kind of where, and I guess to piggyback on to what we did, the request, and I commend Scott as well as Mr. McCoy based on raising the salary, but I would also like to see us for those areas like the county police as well as public works to come up with some kind of incentive employment package. And I guess the question is, why would I want to work for Dougherty County?
Mm-hmm.
If I'm just going to come here and I stay 10 years and I'm at the $10 level and I've been here 5 years and there's no advancement. So I'm looking for a retainage package, and I think we talked about that a long time ago. We had something similar to the 501 or profit sharing, but what's an incentive for a county person to want to come and work for Dougherty County? And I guess that when we talk about, if I've been here 5 years and I have no incentive, of course I'm looking for something else. So the actual question is, can we explore an incentive package or an employment package that will attract people to Dougherty County?
I think it's a fair point, and I think it probably would be good for us all to get maybe a review on what our retirement plans look like and how that has or has not impacted overall turnover. Right. I think you raised good questions there. If memory does serve me correctly, when we were going through some tougher times economically, we looked at whether or not there was a benefit to us changing our retirement plan, and we actually learned that there was not an economic benefit and that it did actually help with overall retaining, because we actually had a better retirement plan than most other communities. But I think your point is very, very well taken. Okay. I agree with you more than you realize. Okay. on the especially when it comes to public safety and law enforcement. I do not like seeing a lot of turnover there, and I commend you for your comments, and I think that's something we are going to have to continue to talk about.
And the last thing is on Highway 19, on the right side, it's a balloon business, like inflatable balloons. That I don't know if we have the license or whatever, but I got a couple of calls from that. It's like the blow-up water inflatable balloon. You'll see them out there on the ground. But, okay. So I don't know what the code has, but I guess just for information. I don't think it's any violation, but just for information, people like, well, how they're doing it or whatever. But that was.
Is that it?
Yes, sir.
All right. Thank you very much.
Mr. Chairman, could I piggyback on what he just said about those balloons down there on 19? I've gotten several calls on that as well. So could we have code enforcement to find out what's going on and let us know what that is so we can answer these constituents' questions about it?
What type of balloon? Are y'all talking about hot air balloons? It's an inflatable water slide. So he's charging people for their kids to come and slide down inflatable water slides. Yeah.
I got you. Okay. I was wondering if we had like a hot air balloon company or something.
So he is in compliance with that, Mr. McCoy? Is he in compliance with that license and everything?
I'll have to find out, Commissioner. I was driving down 19 and happened to see it, I think yesterday.
I got a call about it last night.
Yeah, it didn't seem like they were doing anything illegal. So I'll check.
All right.
Okay.
Very good.
Thank you.
Thank you. All right, Commissioner Hudgens, I think we missed you earlier. You on?
I'm on. Can you hear me?
Yes, sir. Yes, sir. And you were on, and just to make the record clear, Madam Clerk, Commissioner Hudgens was on when I called roll call, but I think we had some technical difficulties. But he has been on and participated in the vote, so I don't want him to be marked absent. Commissioner Hudgens.
Against anything.
Okay. Commissioner Hudgens, did you have anything else?
Not a thing, Mr. Chairman. Thank you, though.
All right, very good. Commissioner Gray.
Nothing further. Thank you.
All right. I just have one thing. Mr. McCoy, I think I'll forward you. I got some pictures that were forwarded to me from the racetrack this weekend. And it was just a bit concerning, the information that I received. And I know that we had already tapped the county police to go and monitor that situation. And obviously, I wish everybody, the ability to make a good living and to do what they need to do. But there were some concerns that were raised. And if you would, just please follow up on that for me. It'd be great. With that being said, we are adjourned, and thank you all.
Thank you.
Thank you.